Many of us try to avoid going to the doctor's office as much as possible, especially if we think surgery is needed. But in tonight's Healthy You report, one local doctor shows us how he treats patients in pain without putting them under the knife.
Sometimes our everyday lives can be a huge pain in the shoulder, hips, or knees. And it's better to take care of these problems now before things get to this point. Dr. Jason Holinbeck is a sports medicine physician who not only treats a number of talented athletes in our community, but regular people whose pain can no longer be ignored.
Even though I'm a sports medicine physician, the majority of what I see are going to be older individuals that are kind of tired of dealing with their knee pain or not being able to have fun running around with their grandkids.
Dr. Holinbeck specializes in non-surgical procedures for patients with knee injuries, sprains, tears, and joint pain. And these patients are either apprehensive or not ideal candidates for surgery. One of his patients happens to have debilitating knee arthritis at only 40 years old.
She was having difficulty at work. She couldn't do the activities she wanted to do, and she didn't want to see a surgeon because she didn't want a knee replacement. So she started seeing me to see if I could help her, and we've done a lot of different things, including like modifying her activity, did a lot of injections with her, and for now it's working well and she's content, she's happy.
He also recommends relative rest to patients whose injuries are creating persistent problems.
You're training for probably a marathon or maybe you're trying to be healthy and trying to lose weight. I kind of need to get you to stop running so I can get your foot better. So basically I would start talking to you about doing something else to do that. So swimming, riding a recumbent bike, row machine, something that your foot can heal but you're still resting.
And taking advantage of physical therapy is always a good idea, whether you opt out of surgery or not.
Well, physical therapy offers a way to treat the patient's primary complaint, which is usually pain, but it also helps to correct the cause of the underlying condition and also to prevent the condition from returning. Some can be treated relatively quickly, some are a longer program or a longer protocol depending on their particular injury or their particular condition.
While surgery can be the only option in some cases, Dr. Holinbeck wants those in constant pain to know there are other options.
The very large majority of problems aren't going to need surgery. I just don't want people out there with knees or shoulders or hips that are killing them, but they don't want to see anybody because they don't think there's anything that can be done.
Dr. Holinbeck and Travis Newberry both work at United Regional's Orthopedic Sports Clinic. For more information on their services, just go to TexasOnMaSonPage.com and search Healthy You.